Today in this session we'll be dealing with the pancreas. Pancreas is a soft lobulated gland. It has both exocrine as well as endocrine part. Exocrine part is the pancreatic acini, whereas endocrine part is the pancreatic islets. So location, it extends upwards and to the left from concavity of duodenum to the hilum of the spleen along the posterior abdominal wall. Lies behind the stomach separated by lesser sac. So it occupies posterior parts of the epigastrium and left hypochondrium. It is retort shaped flask like, and length is approximately 12 to 15 centimeters. Breadth is 3 to 4 centimeters and thickness is 1.5 to 2 centimeters. Weight is approximately 80 to 90 grams. The following are the parts of the pancreas. It has four parts: head, neck, body and tail. Head lies in concavity of duodenum. Neck lies in front of portal vein. The junction between head and neck can be identified in front by groove for gastroduodenal artery and behind by right margin of the groove for portal vein. Then the junction between neck and body will be identified by, in front it is not possible to distinguish, but behind it is by the left margin of the groove for portal vein. Body, it extends from front of abdominal aorta to the front of left kidney. It is triangular on cross section. Junction between body and tail is identified in front. It's not possible to distinguish, but behind, separated by junction of peritoneal and non-peritoneal areas. Tail, it extends between two layers of lienorenal ligament and reaches the spleen. You can see here, this is the head. So this is the posterior view, this is the head, and the right margin of the groove for portal vein separates the neck from the head, and the left margin of the groove for portal vein separates the body from the neck. And here you can see the non-peritoneal area and peritoneal area separating the or helping in identifying the body and tail separately. You can see here tail within the lienorenal ligament. So head, it is contained in C-shaped concavity of the duodenum, flattened from before backwards, lies at a lower level than the body. Vertebral level is around L1 and L2. Features: two surfaces, anterior and posterior, four borders, upper, lower, right and left borders, one process, uncinate process. Anterior surface of the head is directed forwards and laterally, separated from neck of pancreas in the upper and left part by groove for gastroduodenal artery. Relations: upper part, it is non-peritoneal and related to transverse colon. Lower part, it is covered with peritoneum, which is derived from inferior layer of transverse mesocolon, and it is related with coils of jejunum. Superior mesenteric vessels lie in front of the uncinate process. You can see here, this is the upper non-peritoneal part of the head related to the transverse colon, and this is the lower peritoneal part which is related to the inferior layer of the transverse mesocolon. And here you can see the superior mesenteric vessels lying in front of the uncinate process. So posterior surface, it is non-peritoneal, directed backwards and medially, separated from neck of pancreas behind by the right margin of the groove for portal vein. Relations: inferior vena cava and both renal veins, right crus of diaphragm, right middle suprarenal artery, right gonadal artery, right celiac ganglia, cisterna caeli and ajagus vein. You can see here, behind the head, you can see clearly the inferior vena cava. You can see the renal vessels here. Bile duct, you can also see the bile duct here. It lodges in a groove between pancreas and second part of duodenum. Sometimes the duct penetrates the head. Right sympathetic trunk, right psoas major, bodies and transverse process of L1 and L2 vertebrae. All these three structures are separated from the head by inferior vena cava. Borders: upper border is overlapped by the first part of duodenum. Rest of the borders overlap the adjoining surface of second, third and fourth parts of the duodenum. So in the groove between pancreas and duodenum lodges the ventral and dorsal anastomosis of superior and inferior pancreatico-duodenal vessels. The uncinate process, it's a triangular projection which arises from lower and left part of the head, passes upwards and medially behind the superior mesenteric vessels, lies in more posterior plane than rest of the gland. Relations: in front, superior mesenteric vessels as I have shown in the earlier diagram. Vein lies on the right side of the artery, and behind it is the abdominal aorta. and above it is the left renal vein. You can see here, these are the superior mesenteric vessels in front of the uncinate process. Neck connects the head with the body, lies in front of portal vein. Parts: two surfaces, anterior and posterior surface, two borders, upper and lower. Anterior surface covered with peritoneum of lesser sac related to pyloric end of stomach. Posterior surface, it is non-peritoneal related to superior mesenteric vein in lower part and portal vein in upper part. Upper border overlapped by first part of duodenum. Lower border, root or transverse mesocolon is attached to it. Body, it is prismoid in appearance, triangular and cross section, extends from front of aorta to the front of the left kidney. Features: three surfaces: anterior surface, otherwise called anterior superior surface; inferior surface, otherwise called anterior inferior surface; and posterior surface. Three borders: superior border, anterior border, and inferior border. Anterior surface of the body, it is slightly concave, directed forwards and upwards, covered with peritoneum of lesser sac, which is derived from superior layer of the transverse mesocolon. Relations related to posterior inferior surface of the stomach, separated by lesser sac. You can see here, this is the anterior surface or anterior superior surface related to the stomach, separated by the lesser sac, covered by the peritoneum, which is derived from the superior layer of the transverse mesocolon. Here you can see, this will be the anterior border and this will be the inferior border. The anterior border separates the superior surface from inferior surface. So this is the anterior superior surface and this is the anterior inferior surface, which is separated by the anterior border. This is the inferior border. Inferior border separates the posterior surface from the inferior surface. So inferior surface directed downwards and forwards, covered with peritoneum of greater sac, which is derived from inferior layer of the transverse mesocolon. Relations: duodenojejunal flexure, coils of jejunum, left colic flexure. Posterior surface, non-peritoneal. Relations are abdominal aorta with the origin of superior mesenteric artery, left crus of diaphragm, left psoas major and left sympathetic trunk, left suprarenal gland, left kidney across its hilum. You can see here, abdominal aorta, left crus of diaphragm, left psoas major, left sympathetic chain, left renal vessels, left suprarenal gland, left ureteric pelvis, and left kidney along the hilum, left renal vessels and pelvis of left ureter, left suprarenal and left gonadal veins. Splenic vein. The above mentioned structures are separated from pancreas by the splenic vein. Splenic vein runs in the groove from left to right side and receives inferior mesenteric vein. You can see here, this is the splenic vein. All these structures are separated from the pancreas by the splenic vein. Superior border separates anterior surface from posterior surface. Close to right end, it presents a conical projection called tuberamental. Celiac artery is related above the tuberamental. Hepatic artery runs along the right side of the tuberamental, and rest of the border on the left side is accompanied by tortuous splenic artery. You can see here, this is the superior border. So this is the tuberamental, above which celiac trunk is there. Right side hepatic artery, left side splenic artery. Anterior border separates anterior surface from inferior surface, gives attachment to root of transverse mesocolon. Along this border, the two layers of transverse mesocolon diverge, as I have shown in the earlier diagram. Then inferior border separates posterior surface from inferior surface. Superior mesenteric vessels emerge from right end of this border. You can see here, along the anterior border, the superior and inferior layer of the transverse mesocolon are diverging. Tail, it is the narrow left end of the gland, passes between two layers of lienorenal ligament and reaches the spleen. It is the most mobile part of the gland, lies at a higher level than the head, opposite the lower border of T12 vertebrae. Relations: in front, stomach separated by lesser sac, behind spleen and splenic vessels, below left colic flexure. Now coming to the pancreatic ducts. The main pancreatic duct is called as duct of Wilson, begins in the tail by aggregation of smaller ducts, passes from left to right, midway between upper and lower margins and close to posterior surface, receives smaller ducts at an angle resembling herringbone pattern. At neck, passes downwards, backwards and to the right, meets bile duct at posteromedial wall of the second part of duodenum. Both ducts pierce the wall separately and unite to form ampulla of Vater. You can see here. So this is the main pancreatic duct. You can see this smaller ducts joining the main pancreatic duct at an regular intervals at an angle resembling the herringbone pattern. And here you can see It is reaching the posteromedial wall of the duodenum. Along with the bile duct, they both pierce separately, and with the wall of the duodenum, they form ampulla of Vater, which opens at major duodenal papilla. And here you can see this is the accessory pancreatic duct of Santorini, which opens at minor duodenal papilla. So the ampulla opens at the summit of major duodenal papilla, which is situated around 8 to 10 centimeters distal to pylorus. Sometimes both ducts open separately into the duodenum. An accessory pancreatic duct, otherwise called duct of Santorini, receives secretion from uncinate process and pass upwards and to the right in front of main duct. Communicating duct connects main and accessory ducts. Opens at minor duodenal papilla, which is situated 2 centimeters above or slightly ventral to the major papilla. You can see here, this is the ventral pancreatic bud, this is the dorsal pancreatic bud. So you can see the developing dorsal and ventral pancreatic buds. After rotation, you can see the ventral pancreatic bud coming and fusing with the dorsal pancreatic bud. Clearly, you can see the main duct is formed by the distal part of the duct of the dorsal bud and the proximal part of the duct of the ventral bud and by a communicating channel, and the accessory duct is formed by the proximal part of the dorsal bud duct. So now this is the normal pattern. But if the dorsal duct opens separately and the ventral duct opens separately, then this type of condition is called as pancreas divisum. Remember, pancreas divisum. Arterial supply. Head and neck are supplied by the ventral and dorsal anastomosis of the superior and inferior pancreatic duodenal arteries. Body and tail supplied by the pancreatic branches of the splenic artery. So one of the pancreatic branch called as arteria pancreatica magna is longer than the rest and accompanies the main pancreatic duct. Dorsal pancreatic branch, it's a branch of splenic artery or celiac trunk, supplies posterior surface of the pancreas. Capillary plexus supply acina and islet separately. Outflow from islet drains into acinar capillary network, so forming insular acinar portal system. So this also explains possible influence of endocrine part on exocrine part. So veins correspond to the arteries and drain into supramesenteric vein, splenic vein, and trunk of portal vein. Lymphatic drainage, head and neck drains into the ventral and dorsal pancreatico-duodenal group of lymph nodes. Body and tail drains into the pancreatico-splenic nodes. Efferents from these nodes drain into celiac and supramesenteric group of preaortic lymph nodes. Now supply, sympathetic is coming from the celiac and supramesenteric plexus. Parasympathetics are derived from both vagus nerves. Secretory activity of the pancreas, mainly the exocrine, is controlled by nerves and hormones. The hormones are secreted in pancreasemin. Both hormones are produced by duodenal mucosa by the arrival of the acidic gastric contents. Pancreasemin, it initiates release of digestive enzymes from acinar cells. Secretin stimulates release of an aqueous bicarbonate solution from duct cells, which conveys enzymes in an inactive state until they reach the duodenum. So by this prevents autodigestion of the pancreas. Clinical aspects, annular pancreas. This encircles the duodenum, causes duodenal obstruction when deceased. Carcinoma of pancreas arising from head. The complications like ascites due to obstruction of portal vein, jaundice due to obstruction of bile duct, and pyloric obstruction will develop. Pancreatic cysts. These appear in the pancreas and bulge forward and displace the stomach and transverse colon. They does not move with respiration. Then pseudopancreatic cysts. These are chronic collection of pancreatic fluid surrounded by a non-epithelialized wall of granulation tissue, and fibrosis is referred to as a pseudocyst. So chronic collection of pancreatic fluid surrounded by a non-epithelialized wall of granulation tissue, and fibrosis is referred to as pseudocyst. So true cysts will be lined by an epithelial wall, whereas pseudocyst will not be lined by an epithelial wall. You can see here, this is the annular pancreas encircling the second part of duodenum. You can see here, this is the carcinoma arising from the head of the pancreas, infiltrating the duodenal wall. Pancreatic pseudocysts are different from true pancreatic cysts. Both cysts and pseudocysts are collections of fluids. A true cyst is closed structure. It has a lining of cells that separates it from the nearby tissue. A pseudocyst is enclosed and does not have a lining of epithelial cells separating it from nearby tissue. Pessaros triangle or gastronoma triangle is a presentive region in the abdomen between 3 points. The 3 points are like this. Superiorly, it is a confluence of cystic and common bile duct. Or few also consider it as porta hepatis. They take either the porta hepatis as a point or the confluence of cystic and common bile ducts. Then inferiorly, the junction of second and third part of duodenum. Medially, the junction of neck and body of the pancreas. If we draw a triangle joining these 3 points, that forms the gastronoma triangle or Pessaros triangle. You can see here, this is a gastronoma triangle. 90% of the gastrinomas are arising in this triangle. so which is formed by the junction of common bile duct and cystic duct, and then the point on the junction of second and third part of duodenum, and a point on the neck and body of pancreas. All these 3 points, if we form a triangle, so that forms the gastroma triangle. Thank you.